Buenas tardes. It's so wonderful to be here with all of you. Thank you, Assembly Member, for getting me excited again about why we're all coming together to make sure that we're doing right by our kids and families. Just very quickly, thank you for inviting me. Please know that we are all ears, we're listening, our sleeves have rolled up, and we're in this together. As the Assembly Member indicated, though, these are unprecedented times in so many ways. The challenge, of course, that we all know that we're living in is that we don't want to rob Paul and to pay Peter. There's so many issues that are on the table, and we need to look at it holistically. At the same time, we do know that childcare is critical and crucial, but I think it is important to give a nod that there are so many pieces related to healthcare, public safety, family economic support. There are some things that we try to put, some protection around in this budget, but we know that there's a lot of things that we still need to talk about. So very much welcome. How do we ensure that families are maintaining very critical economic supports that they need right now, like the Earned Income Tax Credit and the Young Child Tax Credit, as well as maintaining that we have ability to increase our CalWORKs rolls that we know are going to go up. How do we make sure that we more folks can come onto Medi-Cal that need Medi-Cal? And then how do we protect our undocumented brothers and sisters who are also unfortunately not able to tap into any additional federal funds? So that's the larger context. I will put in a plug for please tell your friends who live in other states too that we do need some support from the federal government now more than ever. We are obviously very grateful for the child care CARES money that we did get, but obviously it's not enough. And we welcome how we do that. I did make note too about how do we not protect childcare in total. If that's the message, that's something that's important as all of you as advocates, as well as program folks, to share that message. And then just remember, there's lots of other folks. So anytime you can build that broader coalition, that really is important. But I want to obviously touch specifically on facilities, because I know that's what you all focus on, and just say thank you for thinking about how do you all, I know LIF has looked at, how do you partner with larger issues? So how do we talk about mixed usage, so that we're trying to crack the nut with housing and homelessness issues, which we know have not gone away right now, and how do we build in childcare facilities there? How do we look at school as the hub, the community hub that so many schools are in our neighborhoods? How do we view that as a space where it's really a prenatal, to adulthood safe space for that all kids, all families are welcomed to get access to healthcare, as well as nutrition supports, as well as, of course, early learning and care support. So I very much welcome how we look at facilities in a broader spectrum, and how you lift up childcare within that, because I think that's going to help us push and get other folks to say, yes, childcare is part of that answer for the economic supports that we know it is, for getting, folks to go back to work, for supporting our vulnerable families. Unfortunately, we've seen an increase in child abuse during these last few months because folks need support, and we need to make sure that care is there to help. As so many family child care folks they are a community connector, they are a resource, they are the cheerleader for so many families. I have to give a shout out to them in particular, because I know with the supplies issues, they've been bending over backwards, as well as the resource from referral agencies and our APs, to make sure that they themselves get the supplies so that they feel comfortable opening up or bringing in more families to their care. But also they are handing the diapers to the families too, handing formula, handing other things, handing food to our families who have lost their jobs or who are seeing a reduction in their hours. So I know family child care, that's how I came up in this as a legislative aide, talking to family child care providers. So I have to give my special tip of the hat to them and say thank you for what you're doing, and we see you, we hear you. We want to know, how do we support our center-based programs, our family child care, and our license exempt, because our system, our quote-unquote system that we all know isn't really a system, is now in some dire straits. So my hope is that you all will keep lifting these issues up, embed them in other larger issues that we also have to solve at the same time, and help us think through what is the new way to deal with this. So as some member have pointed out, we had, the last go round of the 2008 recession, we did lose capacity, and I've been checking, every day where we're at now. So pre-COVID, we had 42,000 licensed programs in play. Now we know that 9,000 of those have closed. The vast majority of those are centers, which had a lot more capacity to serve families. So we are very much aware, how do we do right by our centers, that many had to close because they're on school-based campuses. And so the other piece that I know you're speaking about is the guidance. We've been taking a lot of feedback about how do we balance, how does it pencil out for folks to do care in a way that promotes physical and social distancing, that obviously keeps everyone's public health top of mind. And so we're taking all that feedback back, and there will be additional guidance that comes out that we hope reflects all the various stakeholders who have said, hey, think about this. Hey, remember, this is my story. This is how it'll work for me, or it's not going to work for me. I'm going to have to shut my doors if you're going to say it needs to be 10 kids or less in a room, for example. So I will stop there and just say thank you. I'm going to be here until the end of this call, and then obviously this is not the last time I hope to speak with you all, and very much welcome working together. We have a master plan that's still in play. Please know that facilities is part of that conversation too. So we're looking at what's the short term, the midterm, and the long term way out of this, and we're going to need to do this in partnership with all of you. Thank you very much.